Hi, and welcome to my practice. My name is Widder, and I'm a board-certified plastic surgeon. I've been in practice for 26 years, and I've been operating my surgery center, my accredited surgery center, for 23 years. My practice, which is strictly cosmetic surgery, involves the whole gamut of cosmetic surgery, but I focus on breast implants and butt implants. Well, the buttock implants is a common procedure nowadays, and the advantage of buttock implants over the other method of enlarging the butt, which is fat injection, is that the implant does not disappear. Unfortunately, fat injection doesn't stay beyond 6 to 12 months. And I've seen it on patients, many patients who came to my surgery center for butt implants, and they had fat injection to the butts by other surgeons. So when the patient comes to my office, I explain to them about the process. Before doing the surgery, they have to be committed. You have to be committed for the surgery, because otherwise you will have complication. And in my experience, as long as the patient follow up my recommendation, the healing and the recovery and the outcome is very satisfactory, and the patient are very happy. Where is the incision? The incision is between the cheeks, and when the patient stands up, you cannot really see it. The location of the implants is on top of the muscle, under the fascia. I don't put them inside the muscle or under the muscle because the recovery is more difficult. There are more complications because it's not a natural plane. The size of the implant that you can have inside the muscle or under the muscle is much smaller than the one on top of the muscle or under the fascia. In addition, and the most important factor, is the natural look of the implants. I use the oval round implants, and I place them from the posterior iliac bone crest, which means the bone in the back, which is a normal attachment of the muscle. And from there I go down towards the gluteal crease. That gives a very natural appearance, very attractive appearance, and it also fills up the depressions on the hips, which is a very common concern of the patients. And so by using my technique, you get easier recovery, more natural and attractive look, and you are able to give the patient the size and the shape that they're looking for. The recovery time for butt implants is about a month. Obviously, if there are no problem, and if you follow my instructions, you shouldn't have any problems. So for 1 month, you have to be committed for the process of butt implants, which means that you have to be careful as far as exercise, as far as lifting. You have to sleep on your stomach or on the side. You cannot sleep on your back. because the concern is that you might put too much pressure on the incision and open the wound. And when you drive, you have to drive leaning forward in order to avoid, again, the pressure on the incision. Other important thing, obviously, is to avoid the physical activity, intense physical activity, to prevent bleeding. And so if you do what the recommendations are, you should be happy, and the results should be satisfactory and impressive. Additional information besides our discussion can be found on my website. I have blogs that discuss extensively the procedures and in regard to breast implant or butt implants, and also other procedures. And if after getting all that additional information you want to have another meeting or another discussion with me, you are more than welcome, and you can either call me or call the office and make an appointment. I'll be very happy to see you again and discuss and answer any question that you might have.